I want to begin with some statistics. In 2022, the infant mortality rate in the United States was 5.6 deaths per 1,000 live births. But for Black Americans, the rate was almost double. According to the most recent data from the Centers for Disease Control, again from 2022, Mississippi had the highest rate in the nation. It's nearly triple the infant mortality rate in Massachusetts. Illinois landed right at the national average, with 5.59 deaths per 1,000 live births. Last year, Illinois Governor J.B. Pritzker announced a statewide push to address those disparities. It's a $23 million initiative, in which the state's Department of Public Health is distributing grants to community-based reproductive health care providers around the state. This week on the Crossroads Suncast, how state and local organizations are building better outcomes for parents and babies. I'm Bryce Patterson.
It's really about assuring that the conditions of optimal birth are there for all people, with really a willingness to address racial and social inequities.
That's Dr. Nakia Grayson defining birth equity. She's Chief Clinical Officer for Choices Center for Reproductive Health, an organization based in Memphis, Tennessee, with a branch in Carbondale, Illinois. Choices is one of the recipients of that grant funding from the state, and it's chosen to partner with Carbondale nonprofit the Little Resource Center. As a region, Southern Illinois has severe barriers to care. Those are intensified by other inequalities. Chastity Mays is a doula with the Little Resource Center. She works with parents before, during, and after birth to provide guidance and support. Here's how she describes the drivers of inequality.
We live in Southern Illinois, and sadly, racism plays a role. So I'm just going to tell you that providers sometimes don't listen to all mothers. So then that puts Black mothers at the bottom of that totem pole. So they're not listening to what they're saying, which drives medical issues, then which drives those statistics that we hear about so much of Black women dying and babies dying. So racism does play a role. And I would say just the options of providers here now. So recently, we had one of our providers close. So now families in Southern Illinois have one option for a Medicaid provider. So now we're limiting our options even more and making ourselves more of a maternity desert when it comes to maternal care.
Shrinking healthcare options have a range of impacts on local families. Here's Claire Hughes, administrator of the Little Resource Center.
In 2019, we went from 2 labor and delivery units in the southern 16 counties to just 1. And that has been a big burden on a lot of families who have to travel a lot for that L&D care. If baby's in the NICU, having the support system is just not really an option for a lot of times. In some of our more border counties, we're seeing them go across the river to hospitals there that are closer, and that's not necessarily the most cost-effective option for them, particularly if they're on state aid. Really, the infrastructure itself is not there, and then to compound it with everything Chastity mentioned in terms of provider representation, we're just not okay.
Nationwide, roughly 40% of births are covered by Medicaid. According to Dr. Grayson, that often means a lack of postpartum coverage and mental health support. Let's jump back to that grant funding. Here's how Mays describes the work that the Little Resource Center does in the Carbondale community.
We've actually started offering preconception classes. So if people are thinking about having a baby, we want them to know their choices. We want them to know that they have birth doula services available. We want them to know about WIC. We want them to know about food insecurity. So where are the food pantries if they're having housing issues now? And then when they have their baby, we meet them where they are. I've met people 2 weeks pregnant. I've met people like a few days they're about to have their baby and they need that doula support. And then I see clients 6 weeks postpartum, once a week. So we are here to support families wherever they are. And right now, We are the ones in Southern Illinois offering culturally representative care.
The Little Resource Center also offers material support, like short-term diaper and formula assistance, and provides mental health screenings for new families. Choices describes itself as a comprehensive reproductive healthcare organization. In Memphis, they've offered GYN services, wellness services, and gender-affirming care for the last 50 years. The clinic offered abortion services until the Supreme Court's Dobbs decision overturned Roe v. Wade in 2022. Similar laws went into effect in Kentucky and Missouri, leaving Illinois as the closest state with laws protecting abortion access. The Carbondale branch of Choices opened in October 2022. That's important because Dr. Grayson says it's part of offering complete, well-rounded care.
We also provide birth services, and we recognize that we are just caring for patients at different points in their reproductive life. So some may need abortions, some may need support in terms of preconception health support. Some may need birth support, and prenatal care. And some may need postpartum care. Others may need family planning. So we don't value one service over the other.
Fundamentally, the partnership between the Little Resource Center and Choices is about increasing their ability to offer ongoing care in Southern Illinois. The major output of the grant funding? Recruiting and training doulas in the region. Doulas provide support before, during, and after birth. That support is complementary to the work done by doctors and nurses. The Little Resource Center and Choices are hoping to build up a team that is culturally representative and bilingual. Here's Chastity Mays on the impact a doula has for a new family.
So I recently had a client reach out to me, and she said she wanted a doula because the doula would be the only person who would be consistently there for her throughout her entire pregnancy, right? Because when you're with a provider office, whoever's on call is who delivers the baby. So you don't know who's going to deliver the baby. Nurses change shifts, but I am there from the time they call me when they say, Chastity, we need help, until they deliver that baby. And honestly, I have a relationship with every single one of my doula clients still. Like, I have clients who have 3-year-olds, 5-year-olds, and they'll literally reach out to me like, hey, baby's doing this. What do you think, Chastity? So it's really important to have that like community grassroots person that they trust to reach out to.
As part of the Birth Equity Initiative, leaders in Illinois are working to make doula services more accessible. Dr. Samir Vora is the director of the Illinois Department of Public Health. Here's his take on that statewide move.
We know that those services may not be for everybody, but we know that they also can help a really critical group that needs that added support, that partnership and guidance to go through what we want everybody to have to be one of the most cherished moments in their life, and having that partner that can help them navigate and make that process meaningful.
Another impact of the grant funding? A study exploring the state of birth resources in Illinois. According to Claire Hughes with the Little Resource Center, that research benefits everyone.
Data collection is often fragmented, often missing, and because of that, resources that could be allocated often don't make their way down here. And this is an opportunity for us to take a look at who is serving these expecting families. Who are our doctors, our nurses, our midwives, our doulas? And while we are collecting that data, we also want to find out, what is it like for them right now? What signs of burnout may they be showing? What education do they feel they lack? And then that way we're able to complete a comprehensive report to take back to the state to say, hey, you want to make things better down here? Here's what our workforce needs to continue doing their best job.
Integrating care into communities is a focus at the state level as well.
So much of health is built on community connection. It's built on the kind of ability to lean on your community during difficult times. And we all have faced that during some of the challenges that we've faced in our personal lives. I think part of our goal here in the department is thinking about, well, how do we build community systems?
Illinois' Birth Equity Initiative also includes expanded home visits for new families, a diaper pilot program, changes to Medicaid reimbursement rates, and a child tax credit for low-income families. Thank you so much for listening. If you're enjoying the Crossroads Suncast, please let us know. Like, subscribe, and leave a review on your favorite podcast platform.